This was one of the first few patients that I treated with Daratumumab as monotherapy on the serious clinical trial, and the patient enrolled roughly 4 years ago on therapy. At that time, the patient had his 5th relapse within an 18th month span from the time he was diagnosed. And he had received all available therapies, perhaps except a carfilzomib-based regimen. So when I saw him in consultation, it was clear he had high-risk disease. He did have deletion 17p at the time of diagnosis as well, and was certainly behaving high risk. Never had better than a very good partial response to any line of therapy. I spoke to him about either a Kyprolis-based regimen or going on this study, and he opted to go on the study. And what we observed in him was a very quick and profound response. And alongside that, we also saw a very quick immune recovery. So usually in heavy chain kind of myelomas, you see the involved chain being elevated because that's where the M spike resides on serological examinations, and the uninvolved immunoglobulins tend to be suppressed. So this particular gentleman had a very quick recovery of his uninvolved immunoglobulins, as well as an increase in his absolute lymphocyte counts. And when we looked at this in depth, we found that this gentleman had a robust expansion of cytotoxic CD8 positive cells that appear to be clonal. And we're doing further evaluations to actually examine this in more depth, whether that clonality is the myeloma cell specific or not. He also went into an MRD negative stringent CR status and has maintained that for over 3 years. He's still in a stringent complete response as of today. So this was a very important observation that has enabled us to understand potential immunomodulatory mechanisms of inhibiting or stimulating CD38 on different type of immune cell subsets. It's cases like these, the exceptional responders and the clinical observations that you make that help you identify potential patients who may benefit from therapies at large. So I think looking at the immune profiling of these patients is now being done in early relapse randomized phase 3 studies involving Daratumumab as well as the frontline trials.